I want to take you to Germany, where we're starting our global outlook at. I told you earlier on that some doctors there have gone on a naked protest. They're calling it bare concerns. They're protesting lack of personal protective equipment. Also, in the same country, restrictions on movement have been relaxed for over a week now. But the debate over how early social distancing measures could be eased is getting louder. For more on this, we'll get to talk to Kate Brady. Kate is a political correspondent with our partner, DW. She's joining me all the way from Berlin. Hello, Kate. Right, Kate, it's good to have you. Let's start with the doctors. I mean, this is a story that's been going around here in Ghana, and a lot of people seem very interested in how German doctors are going naked, so to speak, to protest lack of PPEs. Tell us more about that.
Well, it seems that they were actually inspired by some French dentists who actually launched a similar protest online earlier this week as well. And basically the idea of the protest is to show how vulnerable they are themselves if they don't have the correct PPE. And at the moment, German insurers, health insurers, estimate that German doctors are lacking around 60 million single-use aprons. They're lacking as well in around the same number of disposable gloves. So in recent weeks, since we've seen the COVID-19 pandemic develop across the world, manufacturers of PPE here in Germany have been increasing their production capacity, but so far they have been struggling to keep up with the demand. And so this is a pressing issue, particularly in parts of Germany that have been worst hit by the coronavirus pandemic, particularly in Bavaria, for example, and also in western parts of Germany. And so far the government has responded, saying that it now plans to centralise the procurement of PPE. And this is extremely important for medical workers, not only in hospitals, but specifically as well for these general practitioners, for GPs, who we've mainly seen protesting in this naked protest online. As of next week, it's rather expected that we'll see more people going to doctors' surgeries again, as in large parts of Germany, people will no longer be able to be written off sick by a doctor over the phone, which is a special measure that's been brought in during the coronavirus pandemic. So we could certainly see more people going to doctors' practices as well.
I'm going to ask you this, Kate. Over here in Ghana, well, yesterday, I think on Monday, we had a conversation with Thomas in which he talks to us about the measures or the efforts being put in place by the German government to help other countries. How do people in Germany feel about their government having to help other countries when their own doctors are going on this sort of protest?
Well, Germany, of course, is a world leader, and people respect that Germany has a role to play in that. One of the most contentious issues, though, when it comes to helping other countries is this topic of financial aid and financial support within the European Union right now. That's something that always gets a lot of attention from German voters, and that will certainly be a huge issue in the months, if not years, after the world has hopefully overcome coronavirus as well. Of course, the whole world will be dealing with this huge economic impact, and at the moment a lot of the focus from Germany, at least with its European neighbours, has been regarding health policy. It's taken in hundreds of patients from Italy, Spain and France now. But when it comes to economic help, that certainly can be a touchy subject sometimes with many German taxpayers, but many people do understand as well that Germany as a world leader has a role to play, and that's economically as well as politically.
Let's talk about the fact that the debate ongoing about easing of restrictions. How is that debate panning out?
Well, we've certainly seen a shift within the last few days. In the early weeks of the COVID-19 pandemic, The politicians here in Germany and scientists were very much on the same page. We saw them appearing together, but slowly we're seeing a gap appear in the rhetoric that we're hearing from politicians and experts. Politicians are increasingly voicing their concerns about legitimate issues, particularly societal issues, and the long-term effects that isolation, that partial shutdowns and encouraging people to stay at home might have on certain groups of people, particularly the elderly, especially those who are on their own, and also what that might mean for issues like domestic violence, for example. We've seen an increase in the number of calls made to helplines here in Germany in recent weeks. And on top of that, of course, there is also concerns about education here in Germany and what that might mean for younger children's education and also their social interaction. In the long term, experts have found that this isn't healthy, that they're not able to interact with other young children. So there are a lot of issues here to take into consideration, but at the same time you also have the scientific experts, public health experts, warning people here in Germany that the best way forward is to still continue avoiding contact with other people wherever possible. And certainly we're going to be seeing in the next couple of days, as the government reviews the impact and the consequences that this relaxation of restrictions has had so far. And at the moment, there are some rather concerning numbers that keep popping up in the headlines here in Germany over the last couple of days, and that is mainly focused on the reproduction rate, and that has increased here in Germany. So the reproduction rate of the COVID-19 virus in Germany now is at 1.0 again, meaning that for every person infected, they will infect another one person. And just last week, that had been reduced to 0.7. And the number of new cases here in Germany is also no longer decreasing. So those are concerning numbers that both, of course, the politicians and scientists are looking at very carefully right now.
And that will certainly inform what next steps are then taken. Do we know at this point what government intends to do after it's tried to ease the restrictions, you know, as Thomas would put it, carefully and gradually?
Exactly. Well, what we're looking at the moment here in Germany is small phases of 2 weeks. So the relaxation of the measures that we've seen in place so far, they'll be reviewed in the coming days by the government and the state premiers with German Chancellor Angela Merkel to see exactly what the impact has been, whether that was a positive or negative impact when it comes to the number of new cases. But also looking ahead, the German government, the cabinet met earlier today. They discussed extra support for employees here in Germany. Of course, the economic fears here in Germany are still very much real. Economists are still preparing for a deep recession, despite the efforts made to cushion the economic impact of the COVID-19 pandemic here in Germany. And also looking ahead to the summer as well, Germany announced today that it would be extending its travel warning for travel abroad. That's now been extended till mid-June. So a lot of measures are still staying in place, and as I say, they will be reviewed on a fortnightly basis.
Yes, it looks like you're still working from home.
I am indeed. Of course, wherever possible, as I say, I'm trying to myself limit contact with other people. Of course, that is sometimes difficult given the nature of reporting, but wherever possible, we are as a team here at DW as well trying to stay at home to limit contact, but of course keep you all up to date at the same time.
Kate, thank you so much. And our heart goes out to the doctors who are, you know, putting up this protest, but hopefully the government responds to their concerns, and then we'll work that out. We'll get back to you hopefully again within this week or next week. Kate, thank you. Kate Brady is political correspondent with our partners DW, joining me all the way from Berlin.